I spent the last few months testing AI tools that claim they can help medical practices and med spas. I'm going to save you a lot of time because most of them are overhyped, can be done with one of the other tools I'm about to tell you, aren't built for healthcare, or solve problems you don't really have. But there's quite a few of them that are really actually helpful and can be used right now. So in this video, I'm ranking 10 AI tools, showing you exactly what each one's best at, who should be using it, and whether I'd actually recommend it for a healthcare practice today. So no hype, no paid promotions, just what I've learned spending over 20 years helping private practices and med spas. And for every tool, I'm going to give you one of 3 verdicts. Start using it, use it with caution, or skip it for now. And if you're trying to figure out which one of these tools is right for your practice, you can book a free strategy call with me. The link's in the description. Tool number 1, ChatGPT. If you're brand new to AI, this is the place to start. Think of ChatGPT as your everyday operations assistant. Use it to write SOPs, create job descriptions, draft emails, build training documents, or generate a month's worth of social media, all in one sitting. Now, one important rule: never enter patient information or protected health information. Keep it focused on operational and administrative work. For most practices, it's the fastest way to start saving time this week. My verdict? Start now. Tool number 2 is Claude. If ChatGPT is your everyday operations assistant, Claude is your document specialist. This is the tool I reach for when I'm working with long documents or trying to make sense of a lot of information. For example, I can upload an employee handbook, my SOPs, job descriptions, and HR policies all at once. Then I'm going to ask Claude to compare them, find inconsistencies, or summarize what needs to be changed. I also use it to turn messy notes into polished training guides or organized documents. In my experience, Claude does a great job of staying organized across long projects and keeping writing consistent from beginning to end. Now, just like ChatGPT, never upload patient information or protected health information. Keep focused on operational work. My verdict, a strong yes. Use ChatGPT for everyday tasks and use Claude when projects get bigger or more complex. Tool number 3, AI Scribe. If you're a physician, this is going to be the biggest time saver on the entire list. Use AI Scribe to listen to your patient visits and automatically draft your clinical notes. Instead of spending hours after clinic finishing your notes ready for you to review and sign off on after your patient visit. Some of the most popular options are Free, Dragon Copilot, Deep Scribe, and Nabla. But before you buy one, check your EHR system because most of them have a built-in AI Scribe already. Now, this is different than ChatGPT and Claude because it does handle patient information. So before using any AI Scribe, make sure it's HIPAA compliant, encrypts your patient data, and will sign a business associates agreement. If it checks these boxes, this is one of the easiest ways to reduce documentation time and physician burnout. My verdict, strong yes, but verify compliance first. Tool number 4, AI meeting notes. This is one of the easiest AI wins for any practice. Whether you're using Google Meets, Take Notes for Me, or Zoom's AI Companion, or another meeting assistant that offers AI, let AI handle your notes. It records the discussion, it summarizes everything, it pulls out action items, and it even tells you who's responsible. So instead of somebody trying to take notes and participate in the meeting, everybody can stay engaged, and you still walk away with a clear list of what's next. One word of caution: if you are recording your meeting, avoid discussing identifiable patient information, unless you're using a HIPAA compliant one. So my verdict is a strong yes. Turn it on at your next leadership meeting. Tool number 5, AI web chat or a chatbot. This one's a little more of mixed reviews. An AI chatbot can help answer common questions and it's available 24/7. So like your hours of operation, accepted insurance, services, or even how to schedule an appointment. It can also capture leads when your office is closed. And that can take a lot of repetitive work off your staff's plate. But here's the catch. If patients can't actually reach a real person when AI doesn't have the answer, it can become very frustrating very fast. So the best AI assistants know when to hand off to a real person instead of pretending they know everything. And just like other tools that we've talked about, don't use it to collect patient health information unless it's designed to do so in a HIPAA compliant environment. So my verdict for this one is yes, but with caution. Only use it if it offers a smooth transition over to a live person if it doesn't know the answer. Now, if you're watching this and wondering which tools actually make sense for my practice, then that's exactly how I help med spa owners and physicians figure out. Remember, you don't need 10 AI tools. You just need the ones that are right for you. So if you'd like some help, book a free call with me. The link's in the descriptions. Tool number 6, Perplexity. Think of Perplexity as your AI research assistant. When I quickly need to research a topic, compare vendors, look for industry trends, or see what other practices or med spas are doing, this is one of the first tools I open. And unlike ChatGPT, Perplexity searches the web in real time and shows you the sources it used so you can easily check and make sure it's accurate. It's also really good at researching topics for patient education, newsletters, blog posts, or social media ideas before you create the content. Now, it won't replace your own experience, but it can save you hours of research. So my verdict on this is a yes if you or your office manager spends time researching. This tool is absolutely worth adding to your workflow. Tool number 7, Canva AI. If marketing always seems to be the bottom of your to-do list, Canva AI can make it a lot easier. You can create social media posts, patient education handouts, and even flyers, presentations, and brochures without having a graphic designer. Just describe what you want and let Canva kind of create a starting point. Then customize it to match your brand. Now, is it going to replace a professional graphic designer? Absolutely not. But for day-to-day marketing and practice needs, it's fast and affordable and more than good enough. But personally, I would use ChatGPT to help you create the verbiage you need and a plan to enter into Canva AI. Things just turn out a lot better that way. So my verdict is yes. If you have inconsistent marketing, Canva AI can be an easy win. Tool number 8, AI Email Assistant. If you spend a lot of your day buried in emails, this is an AI feature that you should absolutely use. Most email platforms, like Gmail and Outlook, now include AI tools that can summarize long email threads, draft responses, and help you get through your inbox much faster. So instead of reading 10 back and forth emails to help you figure out what was going on and what happened, AI can give you a summary within seconds. You can even draft a reply that you can review and send out. Just remember, email drafts should always be looked at before you send it out. So my verdict, this is a strong yes. If your email platform already uses AI, definitely start using it today. Tool number 9, Claude Cowork. This is an AI that I am really excited about, but it's one that you need to be patient with. Unlike ChatGPT and Claude, Cowork doesn't just answer questions. It can actually complete multi-step tasks for you, organizing files, uploading documents, creating spreadsheets, and building an entire operational system. I can actually see this one becoming incredibly valuable for medical practices. Imagine creating an entire SOP library, HR documentation, onboarding guides, and training materials with very little manual work. But here's the important part. It's not ready for patient information. Right now, I would only use it for internal operational work that doesn't involve patient health information. The technology is moving incredibly fast, but healthcare security and compliance needs to catch up. So my verdict, watch this one closely. I definitely think it's the future, but I'd hold off on using it for anything with patient data. Tool number 10, AI Voice Receptionist. The idea of this is simple. Instead of sending after-hours calls to voicemail, an AI answers the phone and responds to common questions. They can take messages and help patients schedule appointments. It is an exciting technology. I like the idea of it. And some practices are already using it pretty successfully, but it's definitely not ready to replace your front desk person. It still has a long way to go to work well, and it isn't for all practices. If you decide to try it, use it for after-hour calls only. Test it thoroughly, make sure the information that's given is accurate, and always give patients an easy way to contact a live human. So my verdict for this is promising, but I'd start small and use it as a supplement, and definitely not a replacement for your staff. So there's my 10 AI tools for medical practices and med spas. Remember, don't try implementing this all at once. Start with ChatGPT or Claude. Once you've gotten comfortable with that, add 1 or 2 more to solve your biggest pain points. And if you want to learn how to use Claude inside your practice to create SOPs, HR documents, marketing content, and more with clear guidelines for what's safe and what isn't, I made a full video on that, and it walks you through everything step by step. So click here and I'll see you there.